Hi everyone, welcome to Medicine YouTube channel. In this video, we are going to see about thyroglossal fistula. Thyroglossal fistula can be asked as 5 mark in the general surgery. Thyroglossal fistula is a sinus, is never congenital. This is a fistula or a sinus which is not congenital. The difference between fistula and sinus, I have already uploaded a video on it. The fistula has just be like a tube in shape which has 2 openings. Sinus has only 1 opening. This fistula or sinus can never be congenital. It does not come from the parents or from the genetics, and it is always acquired due to the following reasons. It is always acquired. It is not a congenital disease. Infected thyroglossal cyst rupturing into the skin. What are the reasons for the fistula? Are the infected thyroglossal cyst ruptured into the skin, inadequate draining of the when the patient has thyroglossal cyst. After that, the rupturing of the thyroglossal cyst into the skin can cause thyroglossal fistula, or inadequate draining of the thyroglossal cyst. When the proper treatment is not given, incomplete excision or inadequate draining of the thyroglossal cyst, which may cause thyroglossal fistula. Now we will see about the clinical features of the thyroglossal fistula. It occurs at the age of 10 to 20 years. The patient gives a history of swelling in the neck which becomes infected and bursts to form fistula. First, the patient might have a cyst which gets infected and bursts to form fistula. The fistula or a sinus discharge mucus, and after sometimes the fistula closes itself. Sometimes the fistula gets discharged the mucus and it just closes itself, and the fistula sinus, after a few days, it again discharges mucus and it closes itself again. The normal position of the fistula or sinus remain in the midline in front of the thyroid cartilage. In front of the thyroid cartilage, the fistula position is in the midline. The internal opening is on the foramen cecum of the tongue. The skin becomes red, warm and tender. Foramen cecum of the tongue. The fistula becomes infected. When does the fistula becomes infected? The fistula becomes infected, then the surroundings, the skin becomes red, warm, tender, and the fistula secrete the pus. Hood sign. The hood sign is the fistula opening in the neck, which is covered by the hood of the skin. The hood of the skin, the fistula becomes infected in the surrounding and becomes red, warm, and tender. Fistula secretes pus. Hood sign is the important clinical feature of the thyroglossal fistula, where the fistula opening in the neck is covered by the hood of skin. It just present like a hood. The investigation are radioisotope as well as fistulogram. The treatment is infection is controlled with the antibiotics, and cyst-ring operation are the treatment for this thyroglossal fistula. Thank you. If you like this video, please do like, share and subscribe my YouTube channel. If you have any doubt on it, please do comment it. If you want more videos, please do subscribe. The cyst-ring operation is a separate, I will just put a separate video on it. It's just a separate 5 mark. Thank you. For notes, please do follow my Instagram page. I will provide the link in the description box. Thank you.